Well, welcome back to Tampa Bay's Morning Blend. And as we've been talking about, hospitals and healthcare centers have been having to change the way they're doing things these days amongst the pandemic. And this morning, we are happy to welcome back one of our friends and one of the team members that we've had on our show many times, Bradley Hermans from Suncoast Community Health Centers. He's the CEO. And like everybody else, you guys have adapted. You're trying new things. You're seeing the success of some of these new practices that you are putting into place. And from what I understand, Bradley, you're now one of the testing centers as well. So good to see you. How are you this morning?
Good, Carly. It's good to see you again.
Yeah, and real quickly, if you can, you are part of the Morning Blend family. You have your own Morning Blend mug that you're joining with us too.
There you go, huh? Every day.
So, in this new world that we're living in, and I know this has been a lot on you and your team, but I'm so proud of you and your team too, because like so many others, you've adapted well. Give us a little update on how things are going, because you have several locations across the Bay Area.
We do. All of our clinics are back open. Actually, we were able to keep just about everything open except for one in Thanona-Sassa throughout all this. We scaled back a little bit. We had to close our dental clinics for a period of time, but as of now, everything is back open. I'm happy to report that everybody's doing well. And that's really one of the most important things I want to get the word out today is for the patients that are apprehensive about coming back for their health care. Two things. One is it's very, very important that they continue with their preventive health issues. Don't let that lapse. Don't make a bad situation worse. Our clinics are extremely clean. Some of the things that we put in place, from UVC lights to filters in our air conditioning systems, to social distancing, to hand washing stations, to the different cleaning criteria that we place in all of our facilities. We have not had one case of coronavirus being transferred from a provider to a patient or from a patient to a provider. So we're extremely proud of that. As you come to one of our clinics now, you'll have your temperature taken. You'll be asked some questions, some screening questions. And then to also help counter that, or to give patients another option, is our telehealth option. I think we're going to show the number up here in a little bit, but 10 to 15% of our visit now is telehealth. And so we've been kind of moving in that direction. The patients seem to like it. The providers like it. Something we've been talking about for a couple of years, but I guess on a positive side, when the virus hit, this kind of forced our hand to invest in the technology and to become better trained at how to do telehealth and telemedicine for the members of the community.
Well, there's no doubt that this has changed, healthcare in the future. And from what I understand, that's going to be, I'd imagine telemedicine is still going to be in that same direction. And just the cleanliness and sanitizing that you and your team are doing. I mean, I think these are all positives that are going to come out of this and continue, correct? Absolutely.
One of the interesting parts of this, all these initiatives put in place, the flu rate's down.
Yeah.
So it's, this, obviously there's extremes, but some of the lessons learned, because we're going to have to get into a steady state, whatever that's going to look like going forward. And a lot of the things that we put in place, I think, are going to stay in place, and they just make sense from an infection control standpoint, whether it's the coronavirus or not. Just when you're dealing with any type of a disease spreading process, cleanliness, air handling systems, disinfecting, those types of things, are always important and will continue to be so.
Talk about the COVID-19 testing and how this is operating at your facilities, and still what's to come too, because I think there's a lot of talk about these rapid tests that are people are very interested in.
Yeah, Carla, we've actually got a few things going. One is we've always tested for our patients. We've been doing that all along. First, it was patients that had symptoms, were in contact with other people. Then we opened it up to all of our patients. Now we're partnering with the county to do drive-through testing in our Brandon location. We do drive-through testing at the 313 Lakewood property every Monday and Wednesday from 5:30 to 8:30, and then we do it on Saturday from 9 to noon. Last evening, for example, we had 116 residents came through and took advantage of that. That is different than, you don't call our appointment line for that. You actually call the COVID-19 testing line for the county for the drive-through service, and I can provide that number for you if you like.
Yeah, we'll make sure and put that on our website if you send that over. So when people want to find out more information, we have
Sure.
about 30 seconds left.
Right.
Kind of what's your take home? What do you really want people to know this morning as we close out here?
Uh, I want people to know to take this seriously.
Mhm.
However, don't take it to the point that you're not comfortable, to make sure that you receive the health care that you need to receive. Our dental clinics are open. Don't let those preventive dental issues go untreated. It's just going to make things worse later. If you have high blood pressure, if you have diabetes, if you have those issues that need to be addressed, we're open. We're very, very capable of dealing in this environment. So please feel comfortable coming back. And we look forward to seeing you at any of our facilities.
Bradley, thank you so much for your team. There's the website. There's the number. Again, we'll put all this info on our website too, but we wish you and your team all the best. And thanks for sporting that morning blend coffee mug. We love that, Bradley.
All right, Carly, have a great day.
You too.
All right.
All right, stay right there. We'll be right back.